So now that the House of Representatives has passed its version of healthcare reform, we can now turn to the United States Senate. And Senate Majority Leader Harry Reid of Nevada has come up with a proposal that costs less than $900 billion over 10 years, according to the Congressional Budget Office. Of course, the plan doesn't actually start until 5 years from now, in 2014. That's a year after the House version of 2013, and would include deep cuts to Medicare and steep tax increases in order to make all the math work out. And one of those taxes is what's called an individual mandate, which forces people to buy insurance or pay a fine, or even, if the fine goes unpaid, potentially go to jail. The fine comes in the form of a tax penalty to anyone who chooses not to buy health insurance for any reason whatsoever.
And I can make a firm pledge. Under my plan, no family making less than $250,000 a year will see any form of tax increase. Not your income tax, not your payroll tax, not your capital gains taxes, not any of your taxes.
Of course, this fine is not limited to those families making more than $250,000 a year. So has Barack Obama backtracked on his campaign promise?
Probably the most definitive promise you made in the campaign is that no one in the middle class would get a tax increase on your watch. Yet this week, Senator Rockefeller, several other Democrats say that this bill by Senator Baucus is a big middle class tax increase. Do you agree, and does that mean you can't sign it?
Well, I don't agree. I think that what they were referring to, and I haven't looked at the quotes, but I think they were concerned about whether or not this was actually affordable.
It may be good public policy.
No, but George, you can't just make up that language and decide that that's called a tax increase. If I say that right now your premiums are going to be going up by 5 or 8 or 10% next year, and you say, well, that's not a tax increase. But on the other hand, if I say that I don't want to have to pay for you not carrying coverage even after I give you tax credits that make it affordable, then
I don't think I'm making it up. Merriam-Webster's dictionary. Tax, a charge usually of money imposed by authority on persons or property for public purposes.
George, the fact that you looked up Merriam's dictionary, the definition of tax increase, indicates to me that you're stretching a little bit right now. Otherwise, you wouldn't have gone to the dictionary to check on the definition.
In fact, this idea of an individual mandate requiring you to buy insurance whether you want it or not, need it or not, or can afford it or not, is something that Barack Obama opposed as a candidate for president in 2008.
There are people who are paying fines and still can't afford it, so now they're worse off than they were. They don't have health insurance and they're paying a fine.
The argument is the only way to get everybody covered is if the government forces you to buy health insurance. If you don't buy it, then you'll be penalized in some way. And what I have said repeatedly is the reason people don't have health insurance isn't because they don't want it, it's because they can't afford it.
But now the health care bill raises the stakes even more by requiring up to 5 years in jail if you don't get an approved health care plan or pay the penalty for not having it. The version passed by the House was analyzed by the Congressional Joint Committee on Taxation, which said, H.R. 3962 provides that an individual, or a husband and wife in the case of a joint return, who does not, at any time during the taxable year, maintain acceptable health insurance coverage for himself or herself and each of his or her qualifying children is subject to an additional tax. It goes on to say, if the government determines that the taxpayer's unpaid tax liability results from willful behavior, the following penalties could apply. And those penalties are Section 7203, misdemeanor willful failure to pay is punishable by a fine of up to $25,000 and or imprisonment of up to 1 year. And Section 7201 is felony willful evasion is punishable by a fine of up to $250,000 and or imprisonment of up to 5 years. House Speaker Nancy Pelosi even defended this provision in a press conference.
Do you think it's fair to send people to jail for not buying health insurance?
Well, the point is that we want to make sure that everyone has access to health care.
But, Madam Speaker, I'm just trying to understand. If you don't buy health insurance, you go to jail?
Well,
you didn't answer my question.
I think the legislation is very fair in this respect.
According to the CBO, even with the individual mandate and fines or even jail time in the House version, cuts in Medicare, new taxes, and reduced payment to doctors, the health care bill will still not lower premiums. The CBO, when scoring Reid's bill, said this, CBO's assessment is that a public plan paying negotiated rates would attract a broad network of providers, but would typically have premiums that were somewhat higher than the average premiums for the private plans and the exchanges. And the Congressional Budget Office doesn't even think that everyone is going to be covered. Instead of 83% of Americans being covered, it'll be 94% of Americans. And even that's only after bullying Americans into buying health insurance with even higher costs and smaller benefits. So what's the point? The plan costs too much money, which requires steep cuts in existing programs and higher taxes. And that's just not something we can afford right now in this job market. And for what? Something that's going to raise premiums, give us smaller benefits, and not even cover everybody? This is just a bad bill all around.